It's John with Total Knee Coach, and today I'm going to show you how to get in and out of bed after knee replacement. One of the biggest difficulties my patients have right after surgery is lifting the leg. Even if you can lift the leg right after surgery in the hospital, it is normal for 2 or 3 or 4 days after surgery to start having more difficulty lifting the leg. So to get your foot from the ground to the bed can be painful, can be hard to do. I'm going to show you how to do it on your own so you don't have to have anyone help you and you can be as independent as possible with as little pain as possible. I'm just going to take a belt. A regular closed belt works. This is the yoga belt. You can use a gait belt. I'm just going to drop that loop down over my foot, drop the buckle. So now this belt has really good control over my foot. I didn't even have to lean down. Now what I'm going to do is I'm going to go ahead and turn my body towards the position I'm going to be laying down. I haven't really had to put any pressure on that right knee yet, and I'm just going to use that belt to lift the leg for me and swing it all the way up on the bed. No pressure on my kneecap, no pain. Then once I'm in bed, I can use this belt to position my leg however I want to. That's how you get in bed. Once you're in bed, you know the importance of positioning your leg properly. We really need to make sure we get the foot elevated and the knee straight. One way that you can do that is by taking 2 pillows and kind of make a T. We're going to have that doubled up pillow at the heel, single pillow down at the calf. So what you can do on your own if you set it up like this is set your pillows up, use that strap, and I've got myself set up right here where my heel is supported by 2 pillows, my calf is supported by 1 pillow, and no support underneath the knee. This would be an excellent place to rest, to ice, to sleep. Really good, able to get there on your own with very little pressure. Now, for people that don't like sleeping on their back or that's uncomfortable, here's another option. Take that foot, lift it using the belt to take away that pain on the kneecap. Bend that knee up slightly, heel slide with the belt, pillow between the knees, and then you can use this belt to help control your leg onto your side. This would be an appropriate way to sleep as well. My knee is bent a little bit, but at least I don't have support underneath the back of the knee. This pillow takes some of the pressure off my leg. I can sleep like that. When I'm ready to get back up, pillow comes back out. I get to the edge. I control my foot using this belt all the way down to the floor. Very little pain, lots of independence.